Hi, I'm Josh.
I'm Kristen. And I'm Emily.
We're going to talk about poverty with older adults. So to start, we have a nice figure here. It just kind of shows the like America as a whole as a population, and the trends with poverty. As you can see, older adults have actually gone significantly downhill since the 60s, and this goes up until about 2013. So older adults being the lower ones. So I'm going to start with some demographics. Older adults, we can't just say older adults, we actually have to break it down to the young old, which are 65 to 74, the old, which is 75 to 84, and then the oldest old, which are at the highest risk for poverty, being 85 and older. And then the older you get, the more vulnerable you are for poverty, mostly through life events, so your health is declining, limited income, decreased social networks because all your friends are dying. So life kind of hits you all at once whenever you get older. So of the older population in America, about 9% are living below the poverty line, and then about 6% are near poor. And that's just of all the older adults. So people 65 and older that are living in poverty or near poverty. However, in the last 40 years in the United States, it's actually fallen from about 1 in 3 being poor or near poor to about 1 in 10. So it has gone down. We've really changed a lot, which we'll talk about whenever we get to the history. And then you're going to hear throughout the entire thing, women are more vulnerable than men to be poor. Sorry, ladies. It's just how it goes. But the biggest factors to poverty with the older adults are going to be your racial background and ethnicity, geographically where you live, if you're married or not, and then your gender. So we're going to start with the geographical location. Up in the top corner you can see the kind of the bad areas. I actually have a chart that you'll see too. The South is not the best place to live as far as poverty goes. But for older adults, we're going to actually talk about rural communities versus urban communities. Rural communities, you're going to see a higher incidence of poverty. In the rural community, about 17% of the entire population are older adults. So you're looking at the whole population, about 17% are older, so 65 and older. 10% of that 17% live in poverty, and then 26% of that 17% are economically vulnerable. And then you move to urban communities, so more toward the cities. About 12% of the urban population are older adults, and then about 8% of the 12% live in poverty, and then 26% of the 12% are economically vulnerable. We see rural communities struggling more because of their lack of resources, public assistance, and then there's just not a whole lot of money in that areas, where in the cities you have a lot of business, a lot of money is being spent. So here's a graph just to show kind of the trends of poverty throughout the United States. This is the one that I would look at the most because you can see down through the South, it's higher prevalence of poor. I mean, all down through the South, and then you get into the northern areas where it's not quite as bad. Alaska's really bad though. No one really lives out there. Next, we're going to go into marital status. So again, unfortunately, women are vulnerable. Marriage has proven to protect poverty across the lifespan. If you're married, you have 2 incomes, which tends to keep people out of poverty, where if you're single, you're going to fall more into at risk or into poverty. So of the older adults that are in poverty, we see married versus single, 9% are married, about 40% are single. The other 50%, I'm not really sure where that is. The book our text just described married and single. And then it describes incomes. So it's very interesting. I thought it was interesting to see that if you're married, the average incomes are pretty high versus if you're single, they're lower. So I thought that was pretty interesting. And then if you're married, you're going to be sharing these incomes, where if you're single, you're kind of on your own here. So marriage it really does seem to protect men and women across the lifespan. But when we get to the gender part, you'll see that women, just from the past and how women were kind of in the home, they are at risk, more at risk if they are single. And then marriage lowers risks for health-related complications such as depression, life satisfaction, mortality rate goes down. So marriage does seem to protect everybody across the lifespan, especially older adults. So then we get into ethnicity and gender. African Americans, Native Americans, and Hispanics are at higher risk to be in poverty as older adults. You can see that Caucasians are lower compared to African Americans and Hispanics, which are overrepresented. And then gender, the percentages are kind of misleading, but it is because there's more women than men, so it's just it's a little skewed. But about 6 in 10 women age 65 and older are economically vulnerable or live in poverty, which is pretty high. And then if you're 75 years of age or older, you're 3 times as likely to live in poverty than men. And that's because we do see gender biases. Women really weren't in the workplace when they were at their working years. And so today's age, with a lot of women working in 60 or 70 years, whenever they're at these ages, these numbers will probably be a lot different because they will have pensions, retirements, because they work, where 50, 60 years ago from today, it was a lot different. Society was just a lot different. So then we get into a little bit of history about how we have dealt with the older adults in poverty. Back all the way in colonial America, we had a belief that the older adult needed help, and we kind of just helped them out. There really wasn't any programs or anything. Like I said, we just kind of helped each other out. And then we get into up to the post-Depression era, where social insurance programs began to provide income and security for the old and then the unemployed also. Jump to the early 20th century, where we have developed pensions and security for older adults and especially widows, because now we're starting to see wars and stuff, and women are losing their husbands. And like I said, they weren't always working class, so they didn't really have a means of an income, and they never really worked before. So protecting them was very important to prevent women from going into poverty. And then we get into Social Security development of 1935, where we get insurance for the old and the unemployed. And it really helped a good transition for people from work to retirement, because they weren't so worried about money and worried about running out of it. So then we get into the Hill-Burton Act, which expanded nursing home care. As you can see, like 40s through the 60s, we really build nursing home care and then later life care. So the Hill-Burton Act expanded nursing homes, and then the Care Mills Act actually brought custodial care and skilled nursing care. And we think like one nurse to it, and it wasn't like what we see nowadays, like one nurse to 25 people. It's like one nurse to 150 people. Maybe they would kind of jump from nursing homes. So we're introducing higher level of care for older adults, but it's still not quite at the level that it should be at and what they needed it to be at. And then we get to 1965, where the deinstitutionalization for mentally ill, and then those mentally ill, once they are aging, there were a couple programs that were developed, and then we're just kind of expanding our resources. The government was to assist those that were unfortunately deinstitutionalized and kind of left out to hang. So then we get into the 30s, kind of through the 70s, we really start to encourage retirement, because we were seeing a lot of older adults working a lot. So now we're pushing retire, retire, retire. We have these programs, use these programs, which included the Senior Community Service Employment Program that just assisted lower income older workers in finding work and finding stable work and finding good work that they could perform at their older age. And then we get into 1967 with Age Discrimination and Employment Act that just protected older workers. So companies couldn't say, I'm going to pick the 20-year-old versus the 67-year-old just because of their age and they can do more, which was not okay. So we protected older adults looking for employment. And then toward the late 60s, early 70s, we started to reinvent Social Security a little more. We added to it, built upon it, just to protect those older adults that needed it. And then you get the Retirement Security Act that, again, just kind of protected them, protected their pensions, protected their retirement so that it was an easier transition to retire. And then the late 70s to the 80s is when we really get the baby boomers that are starting to retire. And we consider it the aging America. We're looking at the cost of the aging America and the older adults. Healthcare costs jump, number of patients jump, and the government really started to look at cutting costs and eligibility for Medicare and Medicaid, which kind of left a lot of adults older adults in jeopardy because they really relied on the Medicare and Medicaid, especially if they were widowed or they were single and they didn't have insurance from a husband or a previous employer. They really required Medicare and Medicaid to pay for their medical costs. And then so the cost cuts and the eligibility restrictions really left a lot of them in jeopardy. So then we get toward the 80s, where the private sector and educational institutions really began to build resources and really leverage resources to help meet the older adults' needs with the cuts that were made that we just talked about. So we're kind of having them supplement some of the resources. Then we have the emergence of the Gray Lobby. It was a bunch of organizations just to protect and really go after the interests of the older adult and the aged adults, just to help protect them even more. And then once we hit the 90s, we really start to see we're really like pushing for protection of the older adults, which are still in place today. We're starting to see a lot, not only with the older adults, but with the unemployed population in general. You have the Pension Protection Act that insured protections. Before then, you could lose your pensions if your company went under. So now it's protected up to certain amounts. And then even into 2010 with the Affordable Care Act, there were a lot of adults that still were not eligible and still not able to afford health care. So increasing the insurance quality while decreasing the cost really helped older adults and America as a whole. So we're able to encourage the insurance coverage for these older adults and then, like I said, America as a whole, to really reduce the cost of health care and to help those that need it.
Okay, so I'm going to start by discussing some of the key issues in the older population. And the first one I'm going to talk about is employment, income, and economic vulnerability. And with the elderly, they have difficulty seeking employment. Some people just feel like if they're older, like maybe they just don't want to work, they can't work, whatnot. But in the ones that do want to work, they have difficulty seeking employment, and that's because like really nowadays, jobs are based on the amount of education you have, and back when they were younger, education really didn't mean much, and so they would drop out of high school and go to factory jobs, which were considered great jobs at the time. And it's kind of crazy to think that with older adults compared to younger adults spend 36 weeks trying to find a job, where younger adults only spend like usually the maximum about 26 weeks. And with this, they experience larger earning losses, so they might be on unemployment for longer amounts of time or using some of their benefits. And also, those with the fewest resources include women, elderly of color, and also those seniors that live like in rural areas. And some of those resources include limited employment opportunities, restricted access to education to like help them get a job easier, and also lower wages throughout life. And housing is important. We all need a house. And the most prominent issue is affordability. And over 8.5 million households that are headed by older adults who are 65 and older are cost burden. And what cost burden means is you're paying more than 30% of your income towards your housing. And then quality is always a concern because typically if you're spending 30% or over 30% of your income just on housing, you don't typically have the money to live in like a nice area or have the money to build up the place where you're living. And there are also different types of living arrangements older people can have. Substandard housing is what a lot of elderly people, like, they live in substandard housing. And it can negatively impact their health and quality of life, and they may not be able to pay their utilities. So just imagine like your grandma or grandpa having to decide between having to buy food or pay their electricity or gas. What are they going to choose? Most of the time they're going to choose food so they can keep living, but they're going to be stuck in a really cold house during the winter. And also, public housing is heavily concentrated in low-income minority communities and in need of repair, so that goes back to the quality of housing, and sometimes it's substandard. Compared to younger people, elderly are more likely to be homeowners and be free and clear of any mortgages and whatnot, and they are considered house rich and cash poor. And what that means is their equity in their house is way more than the amount of cash they have on hand or have access to. And so these two types of mortgages, reverse mortgages and home equity conversion mortgages, allow seniors to take out cash advances against the equity of their houses. And it doesn't affect Social Security or Medicare benefits, but it may affect their supplemental security income benefits. And then board and care homes are like a cheaper alternative to nursing homes. Some pros are they provide meals and assist with ADLs and those who need them, so like bathing, eating, stuff like that. But it does not provide extensive medical care. So like if you need like a bunch of medicine, they really can't help you if you cannot take your medicine on your own. So that's kind of a bummer. And then the naturally occurring retirement communities is actually a phenomenon where a bunch of people, like older adults, like kind of gather to a single community or like a couple communities nearby. And health and social services become a challenge in these communities because the older adults are in need of increased community-based services. And then institutional living arrangements we're all a fan of as of clinical last year. And 3.1% of those 65 and older live in skilled care facilities. And we think institutional living arrangements, most of us just think straight nursing homes, but there's actually a continuum of these institutions. And they start with the board and care homes, which I just talked about, which provide minimal to no medical care. And then the other side of the continuum is nursing homes, which provides extensive care. And then health encompasses all these things up here: financial barriers, health status, poverty, and then also I'm going to mention some common disabilities in the elderly. Financial barriers in like money-wise can limit you in accessing services, health insurance, and then also make you have a lack of resources, whether it be food and medical care. And elderly that are in poverty are at a higher risk for poor health. And health status is defined as the presence or absence of chronic or acute disease and the degree of inability in an older adult's level of functioning. And those with poorer health and functional changes are more vulnerable to health decline as they get older. Poverty may be associated with disability because of the poverty or possibility of cumulative unhealthy behaviors or untreated conditions due to prolonged hardships or inadequate resources. And those that are most marginalized and it happens to most often are women, ethnic minorities, and rural seniors with physical challenges. And then some common disabilities that just occur with aging affect hearing, vision, learning, movement, thinking, remembering, mental health, and social isolation, which can also lead to mental health issues, which I'm going to talk about now. And risk factors for having mental health issues include chronic health problems, disability, and financial worries. Some psychological stressors that affect people at our age, but more so in the older population, include unemployment, financial worries, poor functioning and physical health, loneliness, social isolation, perceived overdependence, and family conflicts. And those who are most vulnerable for mental health issues include older racial and ethnic minorities who live in rural or urban low-income housing, or they're homebound, so they are not able to go anywhere, or they don't have the resources to go anywhere. And a statistic that I thought was pretty interesting was older adults are 20% of the total people who commit suicide. And some reasons that they don't try to get help are denial of their mental illness, or just the stigma that comes along with having mental illnesses. In terms of caregivers, adult daughters are typically the ones who provide care for their elderly parents or family members, and they're considered the sandwich generation because typically they're taking care of their older family member and then also children under the age of 18 at home. And some of the consequences of caregiving include increased expenses, less ability to prepare for retirement of their own when they are older, and also they have difficulty paying bills because if they're a caregiver, most of the time they're not able to have a full-time job and they're mostly focused on just their family member or like the person in general they're taking care of. And caregiver burden is the persistent physical, emotional, and financial stress and impaired psychosocial functioning of caregivers. And caregivers report having a poor emotional well-being and health compared to those of their non-caregiving counterparts. And then finally, I'm going to talk about pensions. And the primary sources of income for older adults are also considered the three-legged stool. And that includes Social Security, private pensions, and personal savings. And pensions provide insurance for those who have them because they help eliminate poverty and social vulnerability, or economic vulnerability. And those who are more at risk for not having pensions are women and those of ethnic minorities. So women are kind of drawing the short straw here.
Okay, so there are many government policies and programs implemented to help older adults, some of which include Social Security, which is recognized as the nation's most effective anti-poverty program. Basically, if the older adult is above the age of 65, they are eligible for Social Security benefits, and this gives them income assistance to help them with the financial costs of their living expenses. And almost 90% of older adults receive Social Security as part of their income. And unfortunately, if depending on their pension amount, this may affect the amount that is given to them through Social Security. And the average monthly Social Security benefits in 2011 were $1,907 for the retired couple, $1,174 for the retired individual. And then there's also supplemental security income, which is otherwise known as SSI. And it's for older adults above the age of 65 who are eligible because they have limited income and resources. And this can be used for Social Security. There's also Medicare, which is intended to provide older adults with the protection in case they need extensive hospital costs or anything like that, because if you fall and break your hip, obviously it costs more than $1,000 to get that fixed. So this helps them with that financial protection. But this doesn't cover all medical expenses, unfortunately. It only covers hospital and physician care services, and there's 4 parts, Part A, B, C, and D, and they all cover different things. But Part A covers probably the most because it covers hospitalizations, skilled nursing facilities, hospice, and some home health care. Part B covers doctor's services and supplies not covered under regular hospital insurance. And Part C covers anything not covered under Part B. And Part D covers cost of medications. But in order to get Part, of the other parts, you have to pay into premiums and other special plans. And for most older adults, this is not affordable. So that way, because this sounds great on paper, but if they can't afford it, then it's really not useful to them. And then, so we have Medicaid as well, which is to help more financially struggling older adults. And it provides more comprehensive coverage for nursing homes and home health care in case they need it. Also prescription drugs, dental care, hearing aids, and prosthetic devices. And there's also the concept of spending down, which some older adults unfortunately have to do this because if the government sees that oh, you have this nice house, you have a car, then you obviously don't need Medicaid, even though that they may desperately need the financial assistance. So then this kind of encourages older adults to give away those assets in order to be eligible for this plan. And so there's laws enforced to help that or to stop it. And then Medicaid is currently the largest provider of long-term and nursing home care in the United States. And then we also have the Older Americans Act, which is a network of private and public services to help older adults be more independent into the community because most older adults I know don't really want to be put in a nursing home. And so some programs include Meals on Wheels, adult daycare centers, senior centers, senior employment training and transportation services. And in 2011, they tried to revamp the program, but it wasn't reauthorized because they couldn't come to an agreement. And so Congress allocated a budget for this program to keep them going because it's obviously helpful. But even though they allocated a budget cuts had to happen because the program was not reauthorized. And then there's also social justices that go with older adults because we have to advocate for them. So as we get older, we face disabilities, chronic illnesses, and generally poor health. And then so you have to address how are you going to afford for long-term care. And then most older adults don't continue to work, and so that's not helpful. And also I can't talk, words are hard. And then so you also have once again Social Security benefits, but that is not always 100% helpful. And then there's obviously disadvantages if you have to stop working early. You have to stop working earlier because to get Social Security, it's mostly based off how long you worked, the type of job you worked, and so if you have to stop working early, then you obviously don't get as big as a check. And then social workers are really helpful to older adults with connecting them to resources in the community to help them out. Okay, and then another issue is that women often live longer, and like we said previously, they are at risk to be a more vulnerable population. And so they are the most, this is the largest group of SSI recipients because they're more impoverished, and they outlive their husbands. And most of the time, they don't really have a job. I think my grandma had 2 jobs in her lifetime. And so they're unable to meet the cost of expenses. And and then adjustments have not been made in 20 years to cover the amount of inflation and the increased cost of living. I think every single time I go to see my grandpa, he tells me about the time when he lived in Chicago and a steak dinner cost $1.49. Obviously things don't cost that much anymore, so we have to think about can they afford the increased cost of living and inflation. And then there's also cost sharing. So like I said previously, there is costs associated with